How can my family understand transverse myelitis? Imagine your loved one suddenly experiencing weakness, numbness, or difficulty controlling their bladder or bowels. These sudden changes can be alarming, and understanding what is happening can help your family support them better. Transverse myelitis is a condition where the spinal cord becomes inflamed, damaging the protective covering of nerve fibers called myelin. This damage interrupts nerve signals between the brain and the body, leading to symptoms like weakness, sensory changes, and sometimes paralysis. It is important to know that transverse myelitis affects only the spinal cord, unlike multiple sclerosis, which can affect both the brain and spinal cord. Transverse myelitis often appears suddenly, sometimes over hours or days, and symptoms usually develop at a specific level of the spine. For example, if the inflammation is in the middle of the back, symptoms might appear in the legs and trunk. The symptoms tend to be symmetrical, meaning both sides of the body are affected equally. In contrast, multiple sclerosis lesions are scattered and can cause uneven or asymmetric symptoms. Sometimes, transverse myelitis happens as a one-time event, and many people recover fully or partially. But in other cases, especially if it is linked to multiple sclerosis or other autoimmune diseases, symptoms can come back or persist over time. From the perspective of multiple sclerosis, transverse myelitis can be seen as a related but distinct condition. It may be the first sign of multiple sclerosis or a flare-up in someone already diagnosed. However, not everyone who has transverse myelitis will develop multiple sclerosis. Doctors look at MRI scans, symptom patterns, and other tests to determine the likelihood of multiple sclerosis developing later. For example, if the MRI shows lesions scattered throughout the brain and spinal cord, the chance of multiple sclerosis is higher. If the inflammation is limited to one spot and symptoms resolve quickly, it might be an isolated event. For families trying to understand what this means, it helps to remember that transverse myelitis is an inflammatory condition that damages the spinal cord's myelin. It shares some immune system causes with multiple sclerosis but affects different parts of the nervous system and has different patterns. Treatment usually involves medications like steroids to reduce inflammation and manage symptoms. Recovery can vary widely. Some people regain most of their function, while others might have lasting effects. Ongoing medical follow-up is crucial because transverse myelitis can sometimes be a warning sign or part of a broader neurological condition like multiple sclerosis. Understanding these key points can help your family support your loved one through diagnosis and recovery. It's important to communicate openly with healthcare providers, ask questions, and stay informed about the condition. Remember, each person's experience is unique, and medical professionals can provide personalized advice and treatment plans. By learning about transverse myelitis, you can better appreciate the challenges and hope for recovery, while recognizing the importance of professional medical care and ongoing monitoring.